The number of measles cases in the U.S. is surging.
The hundreds of passengers and crew reportedly trapped on a cruise ship this morning because of a measles emergency.
There's an urgent measles warning across more than 20 Melbourne suburbs tonight.
In the headlines and in hospitals around the world, measles has made a massive resurgence. An outbreak in Madagascar has left almost 1,000 children and young adults dead since October. Last year, the biggest increases in cases were recorded in Ukraine, the Philippines and Brazil, and the spread of the virus is frustrating health officials around the world.
We're backsliding on the progress that has been made. And we're not backsliding because we don't have the tools to prevent this. We do have the tools to prevent measles. We're backsliding because of the failure to vaccinate.
The measles virus caused 2.6 million deaths worldwide every year before a vaccine became available in 1963. That's dropped by almost 96% to just 110,000 deaths in 2017. But things are changing. In 2018, reported measles cases increased by 50%.
I consider it really an irony that you have one of the most contagious viruses known to man juxtaposed against one of the most effective vaccines that we have.
This year, the World Health Organization listed vaccine hesitancy as one of the 10 biggest threats to global health. The MMR vaccine, which is 97% effective at preventing measles, protects the entire community through what's known as herd immunity. It's a form of indirect protection that occurs when a large percentage of a population has become immune, thereby providing a measure of protection for individuals who are not, because they're either too young or too sick to be vaccinated. To reach herd immunity, health experts say 95% of children need to be immunised. Declining vaccination rates reduce that immunity, which means the virus is more likely to spread. In war-ravaged and developing countries, access to vaccines is a major hurdle. But in developed countries, it's not. Instead, there's been a significant increase in the number of parents questioning medical advice or ignoring it altogether.
The challenge, I think, in today's world is that most people haven't seen this. And they haven't seen this because the vaccines are effective. You know, I understand sort of that hesitation if you have not lived through these times. We're sort of, in some ways, the enemy of our good work.
That, combined with the rapid spread of fake news, is believed to be responsible for declining vaccination rates.
When parents get much of their information about healthcare issues such as vaccines from the internet or from social media platforms such as Twitter and Facebook, reading uninformed opinions in the absence of accurate information can lead to really understandable concern and confusion in these parents.
This year, Facebook and YouTube cracked down on anti-vax content, and governments are taking steps to increase vaccination rates by banning unvaccinated children from attending school, a decision that's angered vaccine skeptics.
When you take away a person's freedom and medical choice, mandating vaccines for education, that is coercion, and it leads us into a totalitarian regime, taking away democracy.
But will that be the only option left if public awareness campaigns fail to keep us free from the disease? Denise Savoya, The Newsmakers.